has been well documented. With as much detail as possible, please explain what you and/or your party will do to address this crisis. Please address your party's recruitment strategy, budget, timeline, and any other relevant information. Thank you. We'll start this question with Patricia and move to Devin, Randy. Who am I missing? Patricia, Devin, Randy, Kevin, and Andy.
Thank you. And certainly, if you've all been following the Progressive Conservative platform on healthcare, it's a major issue that we are focusing on. And myself, having worked in healthcare since I finished my university degree, during my degrees, I have a degree in social work and psychology and a master's from Dal. So I'm very attuned to health issues in Nova Scotia. And just to quote some numbers, since you asked for numbers to be quoted, I can read them here. Hiring more doctors and specialists, we're committing $13.5 million, expanding the tuition relief program for doctors at $6 million, investing in nurse practitioners, which is something I was very, very excited to see, because I think nurse practitioners will relieve some of the pressure on our family docs and our communities. And something else that's near and dear to my heart is an expert panel on long-term gambling strategy. I worked with the 811 service for Nova Scotia, particularly around gambling. And there's a lot of health concerns that come with problem gambling in this province. So that will also take some pressure off if we can help those folks get the help they need. Mental health and addiction, as many of you know, is an area of my expertise, and I'm very excited to see the Conservative government putting in significant funds for mental health, and not only that, but also establishing an institute with a university so that we have best practice evidence and research in our own province, so we're making the most efficacious choices for those in need. Establishing mental health crisis centers across the province, putting mental health in schools, cutting administration for the health authorities by 2% and then investing that back into our healthcare system. And also, most importantly, well, not most importantly, but something that's also near and dear to my heart, having worked with a community member on this, is the veteran-centered primary care clinic in Halifax, so that we'll have 24/7 care for veterans to walk in for mental health or physical health needs. Having met with a number of doctors in the community and talking to them about the needs, yes, we do need to invest in recruitment, but one of the key things that we need to focus on as a community, which might also align with the community development plan that Musquodoboit Harbour has done, is we need to retain our doctors. It's not just that we need to recruit them. Recruiting is a challenge, and we are investing money in recruiting doctors, but we need to think further about retention. And how do you retain doctors? Is we have to have a good place for them to live and work and play. And retaining doctors as well means having an adequate complement of doctors and nurse practitioners so that they aren't getting burned out. And those doctors coming out of school have the education to work in the emergency, to work in long-term care facility, and work on the inpatient as well. So we need doctors that are well-trained so that they can work in all of those different areas and make sure that we've got a full complement so they want to stay here. And the infrastructure plan is critical to that. Thank you.
Thank you for the question. The number of times this has come up as I've knocked on doors over the last 24 days would not surprise anyone. I've had people come to me and say, you know, I've had 7 different doctors in my lifetime, and that got me to think, my daughter is 2 and has had 2. So where does that put her for the rest of her future? Right now, the current ratio of full-time employees for family practitioners is 1 to 1,121 patients. That's a staggering ratio. Like, so when we talk about the numbers, I think that it's important to be upfront about the need for investment. We can talk about balanced budgets all we want, but when we have one family doctor to every 1,121 people, that's a problem. So, the cost. 60 family physicians at approximately $225,000 a year would cost us about $13.5 million. An additional 60 nurse practitioners at $115,000 a year plus, for the salary plus 5%, is $6.9 million. We have costed all these things out because we know that the investment is worth it. The most important thing that kind of goes with our situation here on the shore is that we are committed to working with healthcare partners to find local solutions to the local needs. This is what I identify the most with. We need to go back and think about the recommendations that have been put forward in the Code Critical report. We've committed to looking at all of those recommendations and implementing all of those recommendations because it's important. The health care that we provide our residents is very important. We are talking about a serious investment of not 13 million or 15 million, but $122 million over 4 years. And finally, an estimated 100,000 people without a family doctor is unacceptable. So this investment is worthy of it. We need to think about our people, and we need to put people first. Thank you.
Moving to this end of the table. Randy?
The other day when I read that the emergency room was going to be closed in Muscatawbet Harbor, I was, to quote Alexa McDonough, shocked and appalled. There's nothing, I couldn't imagine that an emergency room in a hospital, especially out here in a rural community, would be closed when we have to travel probably 40 kilometers to the Dartmouth General should someone had become ill enough to go to an emergency. In my little community down in Salmon River Bridge, there are 5, 6 houses close to it, and each one of those homes has someone in it 70 years or older. Obviously, we're going to get iller, not better, and we need more medical attention than less. And to travel those kinds of distances and have that kind of uncertainties is just pretty dismaying. I have the luxury, if I were ever elected as an independent, of putting pressure on whatever government comes in. It wouldn't make any difference. I have the luxury of being able to advocate for individuals or parties without going through any kind of a leader or cabinet minister or anything else. An independent, who may not know it or may not believe it, has as much strength in the House as any other elected MLA, and perhaps maybe more, because we certainly have more freedom. I would be a strong advocate for better health. We have, contrary to what they say, we have a 2-tier health system in Nova Scotia, not alone in Canada. If I go into a doctor and I need a prescription, the first question after he say to me, you have a drug plan. If I have a drug plan, I get the best, the geriatric, or the brand, sorry. If I don't, I get the run-of-the-mill medication. It's quite obvious. I had mentally ill people whose teeth were rotten by the medications that they were forced to take and had to take to control their illness, but yet they couldn't get money from the governments to have their teeth cleaned and looked after properly. It's absolutely disgraceful. And I don't blame the MLAs or the premiers for this mess. It's the bureaucrats, believe it or not. There are so many managers, and if you will, looking after their budgets so that they can advance their own agendas and their own careers, that they will actually cut funding from the most vulnerable people. Our health care could be dealt in a much different way. Thank you.
Kevin?
Thanks very much. much. This is certainly an important question that we hear on the doorsteps just about every day. So the healthcare system in Nova Scotia, there's no question, has some challenges, and we're faced with a kind of a double barrel thing here with a large contingency of practicing primary care physicians nearing retirement. We're faced with recruitment challenges. Basically every jurisdiction in Canada is faced with the same kinds of issues. So doctors are in high demand, not only here in Nova Scotia, but all across our country and of course throughout the United States. As well as the second barrel of the double barrel is the aging demographic. Those of us that are getting older depend more and more on the support of primary care in many different angles. So it's all kind of coming to roost, certainly over the last few years. So our government took some steps soon after taking office in 2013 to look at amalgamating the district health authorities into one unit. There were some very real challenges in our province in Nova Scotia around many different recruitment strategies, many different barriers that may not have been obvious to the public, preventing primary care service providers from moving from one jurisdiction in Nova Scotia to another. Certainly there was challenges with regards to the provision of services. The way it was done in Digby was different than the way it was done in Cape Breton, was different than the